and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Napoleon's, he's out of the camera.
Well, I know, I didn't think he wanted to get in on this one.
Okay, we're going to talk about today, Brad, we're going to talk about pull-ups done properly with, there's actually a bonus to doing pull-ups properly, bonus back and shoulder relief, right?
Right, and this is something that we've actually discovered in the last few years, but we're going to save that for the end, but it's going to help. These are, if you got some back problems or shoulder issues. As a matter of fact, Bob, I thought, 5 years ago I would have said no to this. This is not working, but now I'm sold on it.
Oh, my shoulders have never felt better. I'm 56 years old, and I mean, they feel great.
Right.
I think once I got to doing pull-ups consistently, because I used to just do them maybe once a week, now that I'm doing twice a week, they really feel good. It's really been a helpful.
I've never done them since I was, whatever, I had to do them for a Presidential Fitness Award back in grade school. I didn't like them then. I thought they hurt my shoulders when I do them. I'm not doing them, but now I'm sold on them. I'm sold on
It can take a while to get to that point.
Right, and we're going to show you how to, if you're not doing pull-ups yet, we're going to show you how you can get into it in a proper manner so you don't hurt yourself.
And if you're new to our channel, by the way, please take a minute just to subscribe. We provide videos. It's over here, right, Brad?
Yeah, usually there, sometimes up
on
there.
the screen. We provide videos on how to stay healthy, fit, pain-free, and we upload every day.
All right. So pull-ups, what good are they, Bob? Strength-wise, I think they're an excellent way to strengthen the upper body in a real gross manner. In other words, it's not focusing on a specific couple muscle groups. You're working the shoulders, the bicep, you're working the latissimus dorsi.
And getting some good core strengthening too, I think.
Exactly. And the other benefits at the end we're going to tell as well for the back. Okay, so a broad exercise, really working you well. You're going to get your heart rate up with this. Now, pull-ups and chin-ups, Bob, what's the difference?
I bet you're going to tell us.
It's very simple. Pull-ups, palms away. Chin-ups, palms towards you. We're going to focus on palms away. We feel it's a better way to do it. It's going to be better for your shoulders.
I think, this is me personally now, just you're internally rotating your shoulders and you're pulling in. I just don't think it's as good for you as, and plus there's so many other ways to strengthen your biceps.
Sure.
So why do you need to do it this way? We're trying to get more onto the lats.
Right, sure. If you want to do chin-ups, that's fine. We're not saying they're bad. Okay. Now, the biggest thing I think with pull-ups is good form. And this is one of those things, one of the reasons I didn't like them, because if I went up to a pull-up bar and I would do them, I would have to go through these gyrations. I'd be jiggling, contortion. If I hump my hips a little bit and I pull my knees up and I jerked it, and finally I could get halfway up and I could get down. If I did that 2 or 3 times, it's like I'm not getting anywhere. My shoulders are hurting me. But there are ways to get around that. So clean form's really important. A nice, clean form, full range of motion. It always is one of those irritants to me when I see someone only doing an exercise, whether it's biceps, and they're not doing full range of motion. Exercise the muscle in its full range for maximum benefits. Pull-ups, get all the way up, all the way down with good, clean form and getting the muscles work the way they should.
The problem, Brad, is a lot of people who haven't done these can't do clean form. So do we have some suggestions for them?
Exactly. Well, actually, let's back up one more spot.
Okay.
We were talking about arm strength. People think pull-ups, arm strength, which is true, but we're also talking shoulder, girdle, and actually kind of the upper core strength. So we're talking about the muscles. We got the mid traps, the lower traps, the rhomboids. All these muscles in here need to contract. And if you can get the muscles, can you just make there you go. And I'm going to now open up, Bob, there. And if you focus, when you do your pull-ups on the scapulas coming together and getting the core of the back and the core of the upper trunk to work, that's going to make a big difference on doing your pull-ups easier. And it's with good form, and it's going to help your posture as well.
It's good for your posture and good for your shoulder.
Exactly. All right. So, unfortunately, we do not have a pull-up rack here where we're video, so we're going to use our white PVC pipe as a model. And if you're just starting pull-ups, you're doing them in your house, you got a pull-up bar.
That's where mine is, in between the rafters down in the basement.
Sure, yep.
So,
you can use a chair. Okay, so you're going to have your pull-up bar up here, and if you cannot do a full one, what you're going to do is have your chair, put your foot up on the chair, and I cannot do this without a pull-up here. I'm going to put both feet up on the chair, and as I pull up, I'm simply going to use my leg power to assist to get up to that point and back down. Am I too high, Lonnie? I don't want to go up there and cut my head off on the screen.
But she gets my head on there, she should be able to.
So simply use a chair, or you could use a stool, whatever, to get your feet up. And when you're pulling up, you simply use your legs to help. And you can also do what we call negatives or eccentrics. I think, Bob, you mentioned before with that.
So like, you go up, again, I don't want to go up too high here, but I'm grabbing onto the pole, and so you start on the chair, and you're just going to
take the bar.
Yeah, I'm going to step off the chair and lower myself down.
Good.
Then I'll step back up on the chair, and then I'm going to lower myself down. So that's just a good, beginner's way of starting to, get some strengthening there.
Right.
Hold yourself as long as you can as you go down,
right,
to start increasing the strength.
They have done studies on eccentric exercises, and it's a really good way to strengthen muscles. It's faster than doing concentric ones, and it's a little easier. It's a really nice little trick to work on.
And then you might mix the two together, Brad. You might start doing, you might help yourself do an assist on the way up, and then lower yourself down.
Sure.
Give yourself an assist on the way up, lower yourself down. Yep. And then help yourself less and left. Maybe just put one foot up on the stool and push up with that.
This is one of those things, once you start to do them, you're going to get a feel for what makes it easier, what makes it harder by your foot or which stool you use. It all falls into place once you just start doing this.
You got to stick with it, though, because I can tell you, again, I used to do these just more sporadically, and I used to feel pain in my neck. I'd feel pain in my shoulders. And once I started doing them consistently, and I don't do them more than twice a week quite often.
Sure.
It really made a difference. Now I love doing them.
Sure. You look forward to it.
Yeah.
As a matter of fact, I'll go out of my way to do them now because the benefits they give to my shoulders. I'm a swimmer, so I used to have shoulder problems swimming because of all the repetitive motion. I start doing the hangs, the part of the pull-up. Before I'll start my pull-ups, here's the bar. I'll just go up and I'll lift my feet off the ground. So all my weight's going through my arms. I'm not going to do a pull-up, but I'm simply hanging there with my arms straight up. And we did a whole video on this, on the benefits it can do to minimize.
There was an orthopedic doctor who really touts the benefits of hanging.
Right.
Shoulder hanging for shoulder pain and shoulder impingement, and even rotator cuff tears.
Sure.
He was a big believer in it. And
he's got scientific studies on it to help. We've got a book that he wrote. It's well written.
Yeah, some people, he has a lot of case studies in the book.
Sure.
Some people really like to use gloves, Brad, because it really can be hard on your hands.
It can.
You and I, Manly, we like to have our calluses, so it doesn't bother us at all.
I just grin and bear it because it's not really comfortable on my hands itself.
Yeah, it actually is a good one to get a pair of gloves, and you're going to be able to grip longer.
Right.
And you're going to be able to do pull-ups better, too.
Yep.
Because you're not worried about your hands.
Right. If you get a blister on there, it's no fun. It's hard to do the next time. What I do is I'll hang there for a count of 10. 1001, 1000. So it's 10 seconds, and then I relax for a little bit, and then I'll go 10 seconds, 3 sets of 10 seconds, makes my shoulders feel better. And also what it's doing, it's actually putting traction on your back. Now I got spondylolisthesis, and I've always looking for something to make my back feel better. This is one of them. And it actually not only just my low back, but even my thoracic back, the traction on my back. I don't have any studies on this, Bob. I'm just talking from my personal history. And on the way home from work, I'll stop just to do pull-ups.
Oh, really?
Yep. And then it takes me 20 minutes. It's really not worth the stop as far as weightlifting or strengthening or whatever.
So you stop at a gym just to do pull-ups sometimes?
Yep. I've got the YMCA. I stop there just to do my pull-ups, and then I leave because I don't have time for anything else, but I'll make 15 minutes because it makes my body feel so much better.
And like I said, I've also added hanging into mine, Brad.
Sure.
Because at first I was just doing pull-ups, and then after we read that book, I'm like, oh, I'm going to do some of that too. So I'll do my pull-ups, and then I'll just hang there afterwards sometimes, or sometimes I'll do it before as the warm-up.
Do you think you could attach that video to this?
Sure, yeah.
Yeah, Bob will attach it.
That one will be at the end.
Okay.
One of the videos at the end, I'll make sure it's part of it.
But I'm still not sure, Bob, if all this information about pull-ups, we're talking about the upper body, the chest, and the back, is it going to help fix that?
Oh, wait a minute, Brad. You got a device though you wanted to show real quick. Didn't
Oh, how could I forget about it? I was going to wrap up the video.
you? Yeah.
I cannot do pull-ups. And Bob used to do them. He'd say, oh, they're so good for me. My friend would do them. And I said, I'm not doing them. They hurt my shoulders. I'm not doing an exercise that creates pain. If you go to a gym that has the big equipment, you know, with the pulleys and all that kind of equipment, side backs.
This is quite a picture, by the way, Brad. Here.
If you look from the side of the view, you're going to see a piece of equipment.
Lonnie, are you getting any of this?
Look at this. I'm not an artist, but right here there's a tray table that comes out. You put your knees on.
Kind of a platform?
It usually folds out of the way, so you might see it hanging.
Okay.
And you're going to bring it up like that. There's a cable that goes up, down, and the counterweight. Now, I cannot do a pull-up for the life of me without this. When I started, I put 70 pounds counterweight, which would push my body up. Here I'm pulling. So literally, it would take 70 pounds of my weight off of my arms.
Sure.
And I'm working now, I'm at 45 pounds. So I'm getting stronger. It's a good way, and I can do perfect form.
And you keep really good form.
Really good form, and I'm really strict about
another
it.
good way for beginners, if they have access, is to start with a machine like this.
And you might see this gym and never, see this in your gym, and maybe didn't even know what it's for.
Yeah, you
unless
may want to
saw
ask
someone
one of
using
the
it.
trainers to know if that's it.
Right.
So,
But-
all right, now we can go, Brad. Remember, we can fix just about anything.
We got to get a speech therapist too. But the broken heart, that's another issue.
Whoa. Thanks for watching.